Well, anxiety disorders are one of the most common disorders in this country. And the good news is there are actually many potential treatments for anxiety disorders.
Generalized anxiety disorder is treated through a combination of psychotherapy and medication.
The most common research-based therapy is cognitive behavioral therapy. The clinician will sit with you and help to identify particular thoughts or cognitions that are negative, that you repeat to yourself, that are worry-based, and help you to identify them, ascertain whether they really fit into the scenario, and then whether you might replace them with a more positive thought or positive behavior. Some patients respond well to psychodynamic psychotherapy, which is exploring conflicts that are causing you to worry. So when you have two disparate feelings in your mind to some degree, you might have anxiety about that. And understanding and bringing to consciousness what those conflicts are can also help diminish anxiety.
So the first line treatment for anxiety is typically therapy. However, when the anxiety is so severe that there is significant impairment and suffering, you look to augment with medication. And the class of medication that typically is used for anxiety are SSRIs.
They allow your brain to have more of the neurochemical serotonin around, which is a chemical that does seem to play a large role in both depression and anxiety. The second line of medication is in the realm of what's called benzodiazepines. And these are and should be short-term use medications because they are addictive. And so someone who presents with an anxiety disorder may be given a serotonin reuptake inhibitor, but in the short term might be given a benzodiazepine to help them until the serotonin reuptake inhibitor, which can take 2 to 4 weeks to kick in, starts to work.
Most anxiety does not go away on its own. They're sticky. Anxiety thoughts are sticky thoughts, and they just kind of keep pulling more thoughts in there. So it can just get bigger and bigger and bigger.
You may be living with an anxiety disorder for a long time and think, but this is just me. This is just the way life is. When in fact, you could be a much better version of you if you didn't have this backpack on your back of all this anxiety. And so if you're thinking, oh, maybe this is an issue, it's really worth tapping in for an evaluation to see how severe this is, how much this is something that could really be dealt with, and how much better you could feel.